First, I found it interesting that dental procedures are about 50% of all medical travel procedures. I found it impactful that there was a study where 4 Americans traveled to Mexico to get a tummy tuck and they were kidnapped. Out of the 4, 2 of them were murdered. This shows the risks of medical tourism, even if it seems to have many benefits. I also found it impactful that a reason patients may travel for healthcare is that there are fewer restrictions, such as their BMI being too high to perform the procedure in their home country, according to the video. Another thing I found impactful is that a lot of patients are required to be close to the hospital for post-op appointments. Because of this, they may need to get an apartment or house and have their families join them. Renting a house or an apartment is cheaper than paying for a hotel by the night, which wouldn't be as comfortable either. Having a house or an apartment would allow them to be comfortable as they recover. An example of an apartment close to the Houston Hospital is Corporate Retreats International. Michelle Nealand stated that 20 to 30% of their residents at any given time are from outside of the U.S. The Medical Tourism magazine explains that Canada is another country that experiences medical tourism. This is no surprise because it is the second largest country in the world. They attract about 14 million Americans each year. Many patients seek healthcare in Canada rather than their local options because Canadian healthcare is less expensive. Some examples of procedures they perform are orthopedic procedures and complex heart surgeries. I researched Canada's revenue from the medical tourism they experience, and according to Grand View Research, the Canadian medical tourism market is projected to grow from $5.6 billion in 2025 to $15.2 billion by 2031. What motivates patients to seek healthcare outside of their local options is money and restrictions. As said in the video, some Americans may be influenced to get a BBL in Mexico. Why? Because it's cheaper there. Does traveling to another place for healthcare have a better mortality rate than in one's home state or country? According to the National Institute of Health, 77% of the included studies identified evidence that patients living further away from healthcare facilities they needed to attend have worse health outcomes than those who lived closer. An example they gave was survival rates. Usually, medical tourism in my family just means traveling out of our small town. For example, my mom and I travel to Sioux Falls for our dermatology appointments, which are only 2 hours away. We also have many of our appointments in Mitchell too. While my sister-in-law was pregnant with my nephew, he had some complications that required her to seek help at Mayo Clinic. Other than that, none of us has ever had to go out of the state for healthcare. However, one of our family friends just recently found out that he has a brain tumor. He got diagnosed at the Mayo Clinic. He still goes there every couple of months for checkups, and his condition requires medical tourism since our small town doesn't have the level of care that is available there.